Hey everyone, and welcome to This Explainer. Today, we're diving into the profound architecture of trauma. And more importantly, we're going to look at the evidence-based blueprints for rebuilding and healing. You know, we hear the word trauma thrown around a lot these days, but the clinical reality of how it physically alters our brains, our bodies, and our futures, it's truly fascinating. We're going to look closely at the root causes of complex trauma and PTSD, and then explore exactly why today's top-tier interventions are just so incredibly effective. Let's get into it. Because there's a lot of complex ground to cover, here's our roadmap for today. First, the spectrum of trauma. Second, risk factors for PTSD. Third, how trauma hijacks you. Fourth, evidence-based trauma interventions. And finally, number 5, why these treatments work. For a really long time, historical treatments almost exclusively focused on a single, sudden, traumatic event. But to really wrap our heads around the depth of this issue, we have to ask a tougher question. What happens to the mind and body when the stress is ongoing and the storm literally never clears? I mean, how do we treat a patient when their trauma isn't just an isolated event in the past, but the actual everyday environment they grew up in? Okay, section 1, the spectrum of trauma, beyond the lightning strike. Right off the bat, there is a stark contrast between acute and chronic trauma. We often think of acute trauma, like a sudden car crash or a natural disaster, as a lightning strike. It's sudden, it's terrifying, and it leaves scorched earth. And honestly, most of our standard models, including the DSM-5 criteria for PTSD, lean really heavily toward this acute response. But chronic trauma? It's completely different. It's more like a leaky roof, where you're constantly bailing water. It's the persistent, ongoing stress of living in poverty, enduring long-term abuse, or navigating a war zone. With chronic trauma, there isn't really a before the storm. The storm is just your normal. And this image right here brilliantly illustrates complex trauma. When repeated intense trauma occurs, especially during those super vulnerable childhood years, it acts like a massive earthquake. It profoundly rewires your entire nervous system. Because unlike a lightning strike that you can eventually walk away from, an earthquake cracks the very foundation of how you see the world. And that leads to deep emotional dysregulation and dissociation much later in life. Furthermore, when this kind of prolonged stress happens super early on, we see what's called developmental trauma. This disrupts early life attachment and growth, much like a tree that's forced to grow completely sideways just to survive in toxic soil. Like, the individual survives, sure, but their biological and emotional development is fundamentally altered. It's kind of like trying to build a complex piece of furniture, but you completely lost the instruction manual. Those foundational attachment structures are simply missing. Which brings us to section 2, risk factors for PTSD. Who develops it and why? So the crucial point here is that PTSD risk is basically a chronological equation. It's absolutely not just about the severity of the event itself, what clinicians call the peri-trauma phase. It's actually heavily influenced by pre-trauma factors like genetic predispositions. For instance, studies have shown that inheriting a short form of the gene regulating serotonin uptake when combined with high stress massively increases your vulnerability. But honestly, even more impactful are the post-trauma factors. The data clearly shows that a lack of protective social support or a major loss of resources after the event is a huge predictor of whether acute stress solidifies into chronic PTSD. Your recovery environment is literally just as vital as your genetics. Moving on to section 3, how trauma hijacks you, the body's false alarm.
Clinically speaking, the symptoms of PTSD are grouped into 3 core clusters. First, you have intrusion, which includes those classic flashbacks and nightmares, where the memory is just involuntarily re-experienced. Second is avoidance, where patients expend a massive amount of energy just staying away from triggers, which often leads to emotional numbing and withdrawal. And third is hyperarousal. This is feeling constantly on guard, super irritable, and prone to sudden outbursts of anger. Essentially, it represents this constant, incredibly exhausting battle between intrusive memories and the desperate effort to push them away.
But, and this is absolutely crucial to understand, your trauma response is also incredibly physical, which brings us to the gut-brain axis. We know now that the brain and the digestive tract are in constant, real-time communication. So when complex trauma rewires the brain's threat response, it quite literally puts your entire digestive system on permanent panic mode. This clearly shows that the impacts of complex trauma go way, way beyond just mental distress. It causes real systemic inflammation and autoimmune issues. Medical research actually links this chronic stress directly to immune system dysregulation. It's exactly like driving a car with the gas pedal just permanently jammed to the floor, right? Eventually, the engine is going to blow. Your body physically remembers and holds on to the stress that your conscious mind is desperately trying to forget. All right, let's turn the corner here to Section 4. Evidence-based trauma interventions, rebuilding the foundation. When it comes to actually rebuilding that cracked foundation we talked about, this quote represents a massive shift in medical understanding. The latest, most comprehensive clinical guidelines from the VA and DoD explicitly prioritize specific active trauma-focused psychotherapies over just prescribing medication alone. Now, while medications can absolutely help manage specific symptoms, like sleep disturbances in the short term, the clinical data proves that targeted psychotherapies impart a much greater, longer-lasting change on those core PTSD symptoms. So what are these therapies? Well, here are the absolute heavy hitters. We have cognitive processing therapy, or CPT, eye movement desensitization and reprocessing, better known as EMDR, prolonged exposure, or PE, and trauma-focused cognitive behavioral therapy. And what unites all of these top-tier interventions is that they utilize really unique cognitive, emotional, or behavioral techniques to help patients safely process their traumatic experiences rather than just running away from them. They are directly targeting that cycle of avoidance we broke down earlier. To highlight just one specific example, let's zoom in on TFCBT. Developed by the National Child Traumatic Stress Network, it's this highly structured yet incredibly flexible model. It was originally designed to help children and families address the really complex needs stemming from deep trauma, like sexual abuse. By combining cognitive behavioral techniques with attachment and empowerment models, it addresses both the individual's internal symptoms and their very real need for external, secure relationships. It treats the whole picture. Finally, Section 5, why these treatments work, rewiring the brain. Okay, so why do these specific therapies succeed where others fail? Well, they work because they fundamentally restructure the patient's relationship to the trauma itself. They empower patients with the exact tools needed to express their emotions, and they foster a deeply safe, culturally competent environment to actually process those terrifying memories. The VA guidelines specifically note that shared decision-making between the provider and the patient is absolutely crucial here. By validating the patient's experience, making them an active partner in their own treatment, and then safely exposing them to the memory without any accompanying real-world danger, these treatments literally rewire the brain's false alarm system. They break the avoidance cycle, they unstick that gas pedal. I want to leave you with this final, incredibly hopeful thought. The data shows us that healing from complex trauma isn't just about going back to who you were before the storm. Because honestly, you can't. Instead, effective trauma treatment is about rebuilding a stronger, deeply understood, and far more resilient foundation for whatever comes next. It is literally about moving from just surviving under that leaky roof to designing a life that can weather absolutely any storm. Thank you so much for joining me on this explainer, and I really hope this provided a clear, empowering blueprint for understanding trauma and recovery.